go to India, and that country remains in lockdown after the latest extension was approved on Sunday. The country went into lockdown on the 24th of March, and schools, public transport and most businesses have been shut since. The world's largest lockdown, covering 1.3 billion people, appears to have helped keep India's numbers relatively low, with a little over 3,000 deaths and around 96,500 confirmed cases. In the southern state of Kerala, which has a population of 35 million, just 601 cases have been confirmed and only 4 deaths. Of course, the actual number of cases may be higher, but the state's health minister, Shailaja, has been praised for her ministry's rapid response to the outbreak. Well, Shailaja joins us now from Kerala's capital. Thanks very much for joining us here, Shailaja. A lot of people are asking questions about why it's been such a success story where you are in terms of keeping the numbers low.
Yes, it is because of our proper timely preparation and setting our protocols and guidelines in proper time. When we heard that newly formed virus, coronavirus or COVID is spreading in Wuhan, China, in the family of SARS virus. At the time we started our preparation here in Kerala.
Can you tell me how you actually made your preparations? So what did you do? Did you impose a lockdown before the rest of the country?
Yes, for setting a lockdown or declaring a lockdown, we started our preparation of the health department. At once we have our RRT meeting and we opened our control room. At that time, no one returned from Wuhan, but we expect that someone will return because there are so many students studying in Wuhan University, in China, and definitely we can expect that someone will return to Kerala. At that time, we opened
in a state and a place where there's 35 million people, are you testing people regularly so you know of the numbers? You know, how are you knowing so accurately these numbers that you have?
Yes, we have formed a scientific strategy for testing. We are tracing the people from the airport itself, and if they are coming by road, by the checkpost itself, and if they are coming by water from the seaport itself, we are tracing the people. Very good trained team was there, and they are examining the people whether they have any symptoms of corona virus, and if they have some symptoms directly from there, we are lifting the patients to the hospital and isolating them and taking the throat swab and sending the samples for a PCR test in the laboratory.
At present, you just have 4 deaths. So at present, you only have 4 deaths.
Yes, we have in our state's calculation it is 3 because one is from Goa, the Union Territory, and he came for treatment in Kerala because there is no sufficient hospitals in Union Territory, Goa, and he died in our hospital. But from Kerala, we have only 3 deaths, and central government is adding that one Goa death also in our account. There is no problem. He came for treatment. He got the virus infection from Union Territory, and he came for treatment in Kerala.
Do your hospitals have the equipment that's needed, and do your health workers have the protective gear that's needed?
Yes, we are listening to the needs of health previously, because we are improving our hospitals, and we have a very good project called Ardram, a mission, and through which the last 4 years we are trying very hard to address the problems in local level itself. We are converting our primary health centers to family health center, providing sufficient doctors and paramedical staffs and nurses there, and we started very good laboratories in primary health center itself,
Are you
and we are
worried?
addressing
Are you worried because there are some places in India where the lockdown has started to ease? For example, in Delhi, the rail system is operating again, so people can go back to their hometowns. Are you worried that as people start to move, it could spread to a place like Kerala?
Yes, so many people are returning from the Gulf countries and all other countries to Kerala because a good number of Keralites are residing outside. We have a very good human resource import from Kerala to the other part of the world, and they are returning to their home state. And we are little much worried because a large number of people are returning at a time, but we are not hesitating. We are ready to receive them and to send them in home quarantine, and with the help of the local self government and police and health workers, we are watching whether they are following our advisories and guidelines
And your advice.
from quarantine.
KK Shailaja, thank you very much for joining us.